The Big WECK presents Buffalo on the Rise, sponsored by Dr. Kaplansky Dental Implants. Get new permanent teeth in 24 hours with our exclusive Teeth Now process. Welcome to the television show devoted to local business, Buffalo on the Rise, with your host, Joe Chili. There's an entrepreneurial spirit in Western New York that's putting our area on the cusp of greatness. Each week, Buffalo on the Rise features local business leaders and decision makers who are shaping our future. If it's about local business, we'll talk about it right here, right now, during Buffalo on the Rise.
I'm Joe Chili. On this edition of the Big WECK's Buffalo on the Rise, meet some amazing people from hometown businesses. Are you living with pain without relief? Our friends from Q C Kinetics are here with alternative therapies. Having a taxing time this tax season and need some expert advice? Meet our guest from Lawler Wiktowski. Remember when doctors made house calls? Those days are back. Meet Dr. Ahmad from Western New York House Physician, who can visit you. All on this edition of the Big WECK's Buffalo on the Rise. Stay with us.
Hi, I'm Joe Chili, mornings from 7 to 9 at Buffalo's oldie station, the Big WECK. Joining us on the Big WECK's Buffalo on the Rise today is Derek Lang, Clinic Director for Q C Kinetics. How you doing?
Hey, doing good, Julie.
I've got to ask you a question right off the bat.
Yeah.
Now, I know you guys, your corporate offices are in Charlotte, right? Q C Kinetics, what does the QC stand for?
So believe it or not, QC stands for Queen City.
Really?
It does.
Well,
Isn't that something that has to do with this area here?
Yeah, Queen City, Buffalo to Queen City.
I know.
Yeah, it kind of brings it all to heart. You know?
And I have no idea why it was called Queen City or QC. I just know it stands for Queen City. Yeah.
All right. So now we get into talking about QC Kinetics. You know, you talk about PRP, even in your commercials. Explain to me again, what is PRP?
Yeah, so platelet-rich plasma. Our bodies produce plasma. Plasma has great healing properties in itself, but platelet-rich plasma takes it to the next level. It's full of platelets and white blood count, and you really want that in order for the body to heal certain things like musculoskeletal, soft tissue injuries, ligaments, tendons. It's a cell-to-cell signaler. It really pushes that healing to the next level.
Can you give me an idea of what the difference between regular plasma and PRP plasma is? Is it like 6 times, 10 times greater? What?
Yeah, so regular plasma, we call that PPP, which stands for platelet poor plasma.
Okay.
Now, that doesn't necessarily mean, like I said, it's a bad thing. But the difference in platelet-rich plasma and your regular plasma is the fact that it does have a higher concentration. We call it liquid gold. And you'll see it whenever we draw the blood and spin it down. When you want good PRP, you can see it in that syringe. Plasma will have a little reddish, almost looks more like blood, but whenever we get that high concentration of platelet-rich plasma, it's that amber, very gold looking.
Liquid gold.
That's right.
All right. What makes regenerative medicine better than surgery as an option?
You come in, you're in pain, they're going to give you some medication, they may want to give you a steroid injection. Ultimately, it's time for surgery, right? It's time to cut and put metal in, replace that area, get you out of pain. But ultimately, you're taking away your own anatomy. You're having to cut that bone, and once that cartilage and that soft tissue is gone, we can't put it back. It's not like a haircut, 2 weeks later it grows back. And
right.
So, regenerative medicine, it has come so far, and QC Kinetics, they really have it down. And so when a patient presents with arthritis, soft tissue injuries, shoulder rotator cuff injuries, anything like that, ligaments, tendons, there are other options that can be better than surgery. And we feel like we have that down. QC Kinetics, they say, Joe, we can't guarantee that someday you may have to have surgery. But what they do stamp their guarantee on is this is about the only option available in medicine that can keep you from it today.
Is it painful to have it done?
I don't think so at all. I actually had the treatments. If if you can take an injection, if you've had a steroid injection before, you know, my specialists, they're highly trained to do this. We even use ultrasound to guide if we need to. To answer your question, if you can take a stick of a needle, fill the area, almost feel like a cloud filling up, that's really all the pain there is to it.
And what type of injuries or what kind of people would you suspect or would want to come in for this type of treatment?
Yeah, so we see a lot of course, arthritis in general. With arthritis, you know, so many people have arthritis. It can be for idiopathic, which means unknown. It can also be from genetically, from your family. It can be, you know, hereditary. But then you do get those soft tissue injuries. You get the rotator cuff. We have a hockey player that came in. He'd been treated with PPP, regular plasma. We told him, he thought it was PRP. Come to find out, we saw the results, and compared to our PRP, we were able to give him 17,000 times more of the platelet-rich plasma than what he thought he was getting. And so I can't be specific, but I'll just tell you that school paid for his treatment to have done.
How many treatments does this generally take?
So it depends on what we are treating, the areas we're treating, and the protocol. Generally, it's between 3 and 5. Most of them are within the first month and a half to 2 months, and there's about 4 within those first 2 months. We treat it very aggressive on the front end. Then we give your body a break, let that mitosis happen, let the regeneration go, and then we see you in 3 months after that. We want to keep up with you each time. And then at the end, we're not just going to pat you on the back and send you out the door. You know, we're going to make sure we'll give you another plasma booster, and as well as a class 4 deep tissue laser that we utilize.
And you feel gradual improvement as this is going on?
You know, a lot of people do. It's one of those situations. I always tell people, you know, when you break a bone, what's the first thing to do? Well, they put a cast on. Well, how long do you have to wear that cast for? Sometimes 6, 9 to 12 weeks. We're not talking about osteoblast and osteoclast here. That's what the bones have to do. And if you take that cast off early, you have a chance of malunion. So I tell patients, time is the worst part about this treatment. And patients they'll start day 1, and then 2 weeks later we get ready to see them. They'll come back and say, hey, can I just get a bunch of those injections I had last time? I'm already feeling good. I said, well, you can, but that's just the first step. Okay. So yeah, it can be gradual. It can be onset after a certain one. Yeah.
All right. Derek Lang, Clinic Director from Q C Kinetics. Thank you very much.
Thank you.
Appreciate it. For more information and answers to your questions, contact Q C Kinetics by calling 716-222-9595 or go to qckinetics.com. Sponsorship and promotional consideration for the preceding segment was provided by Q C Kinetics. And join me weekday morning, 7 to 9 a.m. on the Big WECK. Hi, I'm Joe Chili, mornings from 7 to 9 on Buffalo's oldie station, the Big WECK. Joining us on the Big WECK's Buffalo on the Rise today is Larry Lawler, who is the founder of Lawler and Wiktowski CPAs. Hi, how are you?
Good morning, nice to see you.
Nice to see you too. I have to ask you before we get started, American Society of Tax Problem Solvers. It's on your shirt.
Well, that's just a different hat that I wear because we have in our CPA firm, we actually specialize in representing taxpayers before the IRS. And when we couldn't figure out how to do it years ago, we decided to start a society to teach it. So we teach it all over the country as well.
All right, so, you know, I associate the IRS with problems, right? That may not be the way to do it, but that's what I associate it with them. So what keeps you passionate about solving people's tax problems?
Well, number one, of course, I'm making a living at it. But
okay.
Number two, quite honestly, I've been doing it for a long time, and the making a living at it part is kind of history. Nowadays, it's more the enjoyment of helping people go to sleep at night. You know, it's great how people can compartmentalize. They'll take an IRS problem, put it in the back of their head, and function in every way until they go to bed at night and it sneaks out. That's when they call us.
3 o'clock in the morning
yeah, right.
is when it would sneak
out.
All right, so what about people that say tax problems, you know, they always happen to the other guy. It's not going to happen to me.
Well, that happens to everybody. They say that until it happens to them. You know, it's one of those things where there is no insurance against it or anything else. You should never ever worry about tax problems. Just do what you're supposed to do on your tax returns. Pay your taxes properly. You won't have any problems. You will never have a need for our services.
And don't cheat on your taxes.
Oh, yeah, exactly.
All right. What do you think when people come in to see you? Are they generally frustrated? Are they nervous? Are they angry? What's the mood you see?
I would say yes.
All
of
the
things,
above.
Right. Actually, many times they go through various stages. They come in angry because they've been, picked for audit or because the government wants money from them. After a while, they realize that, okay, well, maybe I was my own worst enemy and maybe I'm to blame, and they reconcile themselves to it. They go through a whole series of emotions. It's our job to listen to them and listen to what they need to get them back on track and get them, resolved.
Is it kind of like jury duty? Like if you get audited once, you're good for 7 years or anything?
I'm afraid not.
Oh, come on.
Hopefully that wasn't a personal question, but no, never consider yourself to be immune in any way. And sometimes, in fact, an audit causes another audit the next year, depending on when they find something. If they found something, they might come back and see that, okay, did you straighten things out now? And they'll take another look. So
in the event that someone comes into your office, shake their hand, sit them down, offer them a cup of coffee or a shot of Jack, I mean, what do you do?
Well, usually what we do, I'd be more than happy to give them the coffee. That always helps, certainly. But the fact of the matter is we listen. And we learn to shut up and just listen. Some people just need to vent, first of all, and you let them vent. But then you find out what they really want, what they understand, what their expectations are, and then we go about solving their problem.
I understand about confidentiality. So can you give us an idea of the worst tax problem that you've had to deal with?
Oh boy, you're asking a big one there. Let's put it this way. How about somebody who hasn't filed a tax return in 36 years?
Oh,
Comes in because, believe it or not, an older gentleman, and he was going to get married for the very first time in his life. Hadn't filed tax return in 36 years, so you can guess that he was just under age 60. Well, his new wife said, no, you gotta be good on your taxes or I'm not getting married. So now he wanted to get straightened out. We got him straightened out because there's some special rules that you can use that might make him only have to file the most recent 6 years.
What about drastic things? Have you actually had people that come in and they're at the end of their rope? I want to sell my house. I want to leave the country. I want to change my name. I want to whatever.
How about suicidal?
No.
I've had times when I've called the Internal Revenue Service agent they were dealing with and said, this taxpayer, I am concerned about their welfare, that they are so distraught over what's going on with you and the government that, we're going to represent them, but I want you to back off, take it easy, and they will. They'll understand that. I mean, they know we wouldn't tell them that if it wasn't true. And I've had people that were that far, others who are just scared to death they're going to lose their home, or they think they're going to come and, impound the family dog and put them up at auction or something. And usually you can deal with the IRS as long as you're willing to face the problem.
What do you think the worst thing people can do in the event that they're being audited or they're being questioned by the IRS?
Ignore it. Worst thing they can do.
People actually ignore it?
Oh, sure. The ostrich method. Haven't you heard of that?
Well, I've
Stick
heard
your head in the sand and, hope it'll all go away, but your butt's hanging out in the breeze.
So if you know something's going to be a problem, you have a feeling something's going to be a problem, do you wait for the IRS to contact you, or do you contact the IRS?
Well, if you know you've got something that's wrong, you should correct it. That's the right advice to give anyone, okay? Generally speaking, though, sometimes people think there's something wrong when there's not. Their best bet is to contact a professional who can help them with it, because it's a complicated area. It really is.
And you don't want to give it away. You don't want to say, I don't want to point something out to the IRS that may not be a problem, and now they're going to look at me.
You may cause your own problem. That's right, and that's not something you want to do.
If somebody can't pay their tax bill, what are their options?
They can get payment plans. First of all, there's a thing everybody in the world's heard of, offer in compromise. The TV ads that say pennies on the dollar. Well, that's for a small number of people. Like about 15% of the people who want that can really do it. But there's payment plans, there's deferred times, that they'll back off and wait for a while. There's a number of different plans that we can use. And we can also make settlements with them in the offer program as well.
Well,
we
you've
do
taken
allow
away
them.
some of my anxiety, Larry. I really appreciate that. For more information and answers to your questions, contact Lawler Wiktowski, CPA, by calling 631-5111, 716-631-5111, or go to lnwcpas.com. Sponsorship and promotional consideration for the preceding segment was provided by Lawler Wiktowski, CPA. And you can listen to me weekdays 7 to 9 a.m. on Buffalo's oldie station, the Big WECK. Hi, I'm Joe Chili, mornings from 7 to 9 on Buffalo's oldie station, the Big WECK. Joining us on the Big WECK's Buffalo on the Rise today is Dr. Ahmad from Western New York, house physician. How are you today, doctor?
I'm good, thank you. Thanks for having me, Joe.
Glad to have you here. Where did the idea of house physician, Western New York house physician, come from?
See, we have a lot of elderly people and patients in community. They have difficulty leaving the house and going to see the doctors in the community. So then they just have gap in the care and all that, and then they stop seeing their providers, and then they just don't have healthcare anymore. So I was just thinking about on those lines how to help these kind of patients. So then this idea came into my mind, why not to do something and going into their houses and see them in the comfort of their house so that they can have their health care.
It's probably nice because then they're on their home turf, you know what I mean?
Yeah.
And they feel more comfortable, I would think, in talking to you. What kind of services do you offer these individuals?
See, we do in-house physical therapy, we do in-house occupational therapy, we actually provide home-based primary care, and we do in-house wound care. We work with different home care agencies who can do going into their houses and draw the blood work, do some radiology tests like x-rays, ultrasounds, EKGs, and echocardiograms. And we also can arrange a lot of DMEs for them, like, for example, DMEs, durable medical equipment like hospital bed, Hoyer lift, wheelchair, scooter, etc., etc.
Now, if an individual is going to use your services, let me clarify here. It's not like an emergency care or an urgent care. Are you their primary doctor?
Yes, we are basically just the home-based primary care. It's just the outpatient going to your house. It's not urgent care, you're right, it's not emergency care. If there's an emergency, we send them to go, ask them to go to the emergency room.
And how's billing done? Does insurance cover this?
Yes, we bill through the insurances, and it's covered by, house calls are covered by the insurances.
How do you think that this helps healthcare costs?
See, it actually reduces the healthcare cost, and there's a study published in Journal of American Geriatric Medicine, and that study compared 722 Medicare patients who were being served by the home-based primary care with control patients, like 2,100 patients. And at the end of the study, they concluded that home-based primary care saves more than $4,000 per patient per year. And it reduces 7% hospital visit, 20% ER visit, and 27% nursing home visits.
So do you have a brick and mortar, like, you know, an actual office that you work out of?
We have an office, but that's only for the administrative purposes, because we go to the patient's houses and assisted living, we see them over there.
You do. Okay, so when you go into someone's home, are there things that you want them to have ready in advance? Do you ask them to have the medications that they're using? Do you ask them to vitamins? Do you ask them any questions in advance of your visit?
Yeah, basically we ask them if they have medication list or medication bottles so that we can know what they're taking, and their insurance card so we can take a picture of that and then enter into our system. So that's basically we ask them to have.
How do you think your work, Western New York Western New York house physician, how do you think that it's been accepted by the public?
It's very well accepted, you know. It's a very needed service which we provide because of the fact, as I was explaining to you earlier, that these patients cannot leave their house. So they are happy that we go and see them in their houses. They are happy, their family members are happy, so it's very well accepted.
Now, when you start talking about, we've discussed elderly patients. Do you just administer to elderly, or do you have different age patients?
In the community, we see 65 and older.
Okay.
And if we go to assisted living facilities, then we do 55 and older, because they also take 55 and older patients in assisted living facilities.
Is it just asking about their basic health, or if they have heart problems or something like that, do you have to send them somewhere else?
Yeah, it depends. I mean, if we think they need to see a cardiologist or pulmonologist, a subspecialty, we can always refer them. If they're willing to go, and if somebody can take them to the specialist, they would go. If they say no, they can't go, they don't want to go, they are not able to leave the house, then we just manage them as much as possible.
This is it reminds me of a throwback to kind of the old days. When I was young, doctors used to make house calls, and then it just became outdated. Do you think this is something that's going to find its way into medicine again?
Yeah, I strongly believe this is the future of medicine. This is what I think, that maybe in 15, 20 years, there will be a more and more home-based primary care. You will be seeing those, because people will become more elderly, and then they will need that service.
I think this is a great service that you've provided, and I think it's very intuitive for you to do something like this.
Thank you.
Thank you very much for joining us.
Yes.
For more information and answers to your questions, contact Dr. Ahmad by calling 716-474-5983 or go to wnyhousephysician.com. Sponsorship and promotional considerations for the preceding segment was provided by Western New York House Physician. And don't forget to join me weekday mornings, 7 to 9 a.m. on the Big WECK.
Thanks for watching this edition of the Big WECK presents Buffalo on the Rise. For information on this and other shows, go to our website, bigweck.com, and find out how you can participate on the program if you're a hometown business. I'm Joe Chili. Thanks for watching and listening to the Big WECK, Buffalo's oldie station.
The Big WECK presents Buffalo on the Rise was sponsored by Dr. Kaplansky Dental Implants. Get new permanent teeth in 24 hours with our exclusive Teeth Now process.